Good morning. Good morning, everyone. We're going to go ahead and get started at this time. We've got a full day ahead of us, so I want to go ahead and make sure we keep things moving. Thanks so much for joining us here this morning. We've got a great program planned for you. I'm going to quickly just go over some of the CE instructions or CME instructions. And then also, I just want to give a welcome. We have many people joining us virtually, so I want to give a welcome to the virtual audience. If you're joining us virtually, you are still welcome to and actually encouraged to also complete an evaluation form so that you too can get credit. I will be putting a link to the evaluation form in the chat section so you can access it virtually. And then also, if you're a virtual participant, we will be emailing you a link in the next 24 hours for you to complete the evaluation form. Special thanks goes to our course directors. Over the last few months, our course directors have worked so hard to pull this program together for you. So I just really want to give a shout out to them. They've spent many hours making sure this would be a successful day for everyone. These are the educational objectives for the program. These are the financial disclosures. You've also should have received an email with all of this information. And then so this program is accredited by Rush. It's accredited for nurses, physicians, and pharmacists. And in order to receive credit, you will just need to complete the online evaluation form. There is a link to it in your paperwork, and there's also a QR code to it in your paperwork. And in addition, on Monday, you will also receive an email with instructions and a link to complete the evaluation form. After you complete the evaluation form, there'll be instructions at the end of that where you can print up your certificate. Today's program is being video recorded, and we will make all these presentations available online for credit for you probably in the next 2 weeks. These are the accreditation statements. And then I especially want to thank our exhibitors today. I can't stress enough, this program absolutely will not take place without the companies who have agreed to exhibit. Please just take a few minutes and visit with these the exhibitors who are here. They, like you, they're spending their Saturday here and they've made the program possible. And just in case you weren't informed when you checked in, inside of your packets, you will have, it almost looks like a tic-tac-toe board, but with many blocks on it. When you go to an exhibitor table, have them stick a sticker on there. And then I forget how many you have to have. I feel like it's 6 or so. If you have that many little stickers on it, you're going to turn it into the registration desk, or I'll be collecting them throughout the day. At the end of the day, we're going to draw winners. We have 3 $100 Visa gift cards, so we'll be drawing winners for that. So at this time, I have the pleasure of turning this program over to Mary Ellen Hand, who is one of the course directors. Mary Ellen Hand is I know most of you, if not all of you, know her. She's a nurse clinical manager here at Rush.
Good morning. Thank you everyone for coming this morning on a Saturday that's so beautiful outside. We are excited to put this program together and share with you a lot of information about thoracic oncology, which we know is important as the leading cause of death in the world. We will have 2 presenters in our first session. Dr. Mary Jo Fidler, who is the Alice Peary Wirtz Professor of Medical Oncology at Rush University Medical Center, will be speaking to us on the state of lung cancer in 2024. And Dr. Kusha Paderi, Assistant Professor of Medicine, Department of Hematology, Medical Oncology, and Cell Therapy, also at Rush. He will be speaking to us about the evolving role of genomics in thoracic oncology, equipping nurses for precision care. And all of you who are sending box kits every day understand the importance of that. After Dr. Padari's presentation, we will be taking a morning break, so you can head over to the conference room C where there'll be some more food. I think actually they delivered it there and not there. We've had a little problem with our food delivery this morning. And we'll take a little break at that time. So the other important thing is there's washrooms behind us, and we've made the doors open so anyone can come and go that way. So this is room A and B, and room C is where the food is, which is just around the corner. So thank you, and I will introduce Dr. Fidler.
Thanks everyone for coming, and thanks very much to the sponsors. I was asked to give a quick introduction talk It's a delight to be here. And thanks to all the conference organizers who did so much work for this. So the title of my short talk is, "It is great to be a thoracic oncologist these days." When I started, we had platinum doublet chemotherapy. We were starting to learn about even just, is there a role for chemotherapy after surgery to prevent recurrence? And then, oh, well, is there a role for continuing chemotherapy, which a lot of other cancer types did at the time, but lung cancer was 4 cycles and that was it. So just to look back where I started and where we are now, it's really quite extraordinary. This slide will probably appear a couple more times or something similar to it. We see that the lung cancer death rate has been coming down, which is a really exciting for, nationally for our patients, and, hopefully internationally, we'll see some of these benefits really trickle in as well. It's thought that it's multifactorial. One is certainly lung cancer screening, and I'm sure we'll hear a little bit more about lung cancer screening a little bit later, but that certainly saves lives. And now we're trying to figure out, A, how to get increased pickup, and B, are there other ways to capture patients for screening? Historically underrepresented minorities may not be eligible in areas where there could be a light smoking history for a long period of time starting in an early age. And we just don't know if, those patients could be eligible for lung cancer screening and receive the same benefit. But certainly implementing for who's eligible now and probably has caused some of this decrease in death rate. We have better and newer targeted therapies. And of course, we have the immune checkpoint inhibitors, where we see people living a long time now with even an advanced cancer diagnosis. And here's a shout out to Annie and our lung cancer screening program at Rush. And you can see that they've really done a great job of including patients from our area. We have a nice ethnic racial mix and a fairly high lung cancer incidence rate of over 3%. This work is clearly impactful, and, many of these patients are diagnosed with earlier stage and really impactful for their outcomes. This is a little smaller than I intended as far as the words go. This is just a table as an example of all of the approvals we've had, and some of these are still in trials, but many of them have FDA approvals. Even just in the last 2 days, we've had a new approval in lung cancer with a immune stimulating agent in small cell lung cancer, which is huge news. And we've seen progress, and I believe the progress will continue to follow at a rapid pace. But it is a complex situation. Dr. Paidar is going to talk a little bit more about some of these molecular targets and how we look for gene targets. But the graphs representing the molecular information for lung cancer get more complicated and more complicated as we go with new targets. And just recently we had a pan-tumor approval for immunohistochemistry expression of HER2. Whereas, at first that came out for the HER2 mutation, which is quite different than the breast cancer scenario, which relies on FISH and HER2 expression. So it's become quite complicated. And I think these meetings are important to help people stay up to date and understand where we're at, because it is a moving target. Just other big changes. We know now that applying targeted therapies after surgery can have a dramatic improvement in outcome. These are the curves from adding osimertinib after surgical resection in lung cancer. And, we typically in our lung cancer trials hadn't historically seen these wide gaps of showing a large benefit with the study arm. And we've seen similar benefits using ALK inhibitor in resected lung cancer. We know that adding chemotherapy and immunotherapy preoperatively can make a big difference in event-free survival. We also have data saying that doing postoperative immunotherapy can improve, outcomes. And this is really changing the field and a subject of big discussion at tumor board when there's more than one way to treat patients. So in summary, our patients are doing better, and it's really great to, as I mentioned, to be a thoracic oncologist. Part of this is from our CT screening efforts. We've seen dramatic development with collaborations with industry to move targeted therapies to patients quickly. We've seen expanded use of existing therapies and immunotherapy combinations in the perioperative setting and in the metastatic setting too. And also we've had increasing collaborations, I think, in general with patient advocates that hopefully will lead to better trial designs and more meaningful outcomes to apply, right away to patients. And on that note, just a shout out to Jill Feldman, who is in a couple of weeks being honored with the Patient Advocate Recipient Award of the Year. I probably said that not quite right, but huge at the American Society of Clinical Oncology. So I look forward to seeing her get, hopefully it's a plaque or not just a little medal. So we'll see what she gets. But that's all I had. Any questions for me? It feels like I got a full agenda today. Okay, well, thank you very much for your attention.